In this video, we'll be talking about the Australian healthcare system. The Australian healthcare system is a complex system. However, it is one of the most affordable, accessible, and comprehensive systems in the world. It promotes healthy lifestyles and ensures that all Australians have access to healthcare and other health services. The system is a multifaceted web of public and private sectors. Some of these sectors will be mentioned throughout this video, which includes pharmaceutical benefit scheme, health insurance, the health workforce, health in rural areas, and public hospitals. The Pharmaceutical Benefit Scheme provides Australians affordable and reliable access to necessary medications. It is an important factor in the Australian healthcare system as it provides a lower cost to residents. The scheme ensures that everyone has access to medicine, even those who are vulnerable or live in rural or remote areas. By doing so, it creates equitable access for individuals in order to improve the health and well-being of all Australians. The Pharmaceutical Benefit Scheme influences the Australian healthcare system greatly as it covers anyone with a Medicare card. This includes all Australian citizens and permanent residents. Another factor is that it is one of a few schemes to cover the whole population, whilst in other countries like America, only a selected group is covered, such as low-income people. Though the Pharmaceutical Benefit Scheme has many positive factors, there are also weaknesses that run throughout the scheme as well, such as it does not include all medicine dispensed in Australia, and drugs that are more expensive tend to have more restrictions.
Australia's current healthcare system is described as a universal healthcare system which currently includes two main sectors, public and private. Australian citizens are currently entitled to receive Medicare, which covers most major services including bulk billing when visiting a general practitioner. Although a majority of general services such as X-rays and GP visits are covered under Medicare, services such as private hospital services and chiropractors, just to name a few, are currently not covered under Medicare. Therefore, if an individual wishes to access these services, they should consider buying out private health care insurance, which will therefore cover these services to an extent, depending on which type of private health insurance cover they wish to choose. With everything, there are pros and cons to the situation, including that of the Australian healthcare system.
The healthcare workforce. The healthcare workforce is the heart of the Australian healthcare system. It is made up of all the people currently working in the healthcare field. It is different from the healthcare labour force, which also includes those who are qualified but not currently working in healthcare. The number and distribution of healthcare workers grows as demand for health services grows. Nurses make up the largest group of the healthcare workforce, at over 50%, and more than 3 times the number of the next largest group. These groups do not often work on their own. When it comes to patient care, it is considered best practice to work in multidisciplinary teams in order to offer holistic care. For example, a person who is diagnosed with cancer won't only work with one medical practitioner. Instead, they will work with a team of different healthcare professionals to ensure that they receive the best possible treatment. It is only in primary care settings, or settings where services can be accessed by members of the community without a referral, that any of these professionals will be likely to work alone.
Rural is an area that is outside of cities. Rural health has been an ongoing issue in Australia. The Australian Institute of Health and Welfare reported that they have higher rates of death and generally poorer health outcomes than in major Australian cities. The reason for this may relate to differences in access to healthcare services, risk factors, and in the living environment. Rural areas generally have poorer access to and less choice of hospital services. There are lower rates of GP consultation and higher rates of hospital admissions. A factor that may have influenced this is the lack of health education or limited access to health facilities close by. In 2009-2010, the federal government has allocated a new funding for rural health. It aimed to improve the health workforce by providing greater initiatives for doctors to work in remote areas. Interventions and education programs have to be introduced to address barriers to accessing healthcare. However, rural health is still lower than major cities, and there needs to be ongoing monitoring and evaluation to see what works well, where, and why.
Public hospitals are one of the greatest contributors to the Australian healthcare system. The state and territory levels of government administers public hospitals. Public hospitals were established for acute and long-term care. With Australia's age expectancy increasing, there is a likelihood of increasing demand on the public health sector. Public hospitals possess strengths to the Australian healthcare system. These include no added expensive costs as it is funded through the taxation of individuals, the Medicare levy and the Medicare levy surcharge. The amount paid is based on the salary of the individual. With funding, patients are able to receive free medical and surgical care. However, there are flaws to public hospitals. The weaknesses include lengthy waiting lists for elective surgery, limited beds, and no choice of doctor for in-hospital treatments. Despite the strengths of the public hospitals, there are weaknesses that need to be considered.
As we've discussed throughout this video, there are a large number of strengths inherent in Australia's healthcare system. There are a large number of weaknesses too. These include lack of health professionals in rural areas, long waiting periods for public health services, and disparities over which government, federal or state, will fund hospitals. These negatives are not small, and while it may take a while, we need to look at ways we can fix these issues. However, despite the negatives, Australia's healthcare system continues to be one of the most equitable, accessible and affordable.